Thank you, Liam. That was fantastic. Can I get all the speakers to come up and take a seat? And while they're doing that, there's somebody I mentioned at the beginning who I've yet to introduce, and that is Associate Professor Robyn Schofield. Robyn is a leading aerosol scientist and atmospheric chemist, and he's joining us today from the University of Melbourne. She was one of the main reviewers of the Academy report, so we're really looking forward to her input and insights and increasing depth of our conversation today. She's an Associate Professor at the School of Geography, Earth and Atmospheric Sciences, and also serves as Associate Dean of the Environment and Sustainability within the Faculty of Science. Her work spans environmental and climate change and more recently indoor air quality. She manages a suite of atmospheric monitors, and her research has taken her from the tropics to the poles and from the ocean surface to the stratosphere. During COVID-19, her incredible expertise extended indoors into the classrooms, lecture theatres and hospital wards where so much of this story truly began. Thank you very much for joining us, Dr. Schofield. And excluding your work and the work of the Melbourne University would be a travesty and would be a link missing in our chain that we need to build. So thank you for joining us. So can I start by asking you a question? Can you tell me, what are the science advances you would most like to see right now in return to safer air? To get us there, what would you recommend?
Well, thank you very much. And in listening to these amazing people before me, I'm going to summarise it as with 4 M's. So multidisciplinarity, multi-pollutant, monitoring and management. And so for the multidisciplinarity, clearly we need lots of different expertise in the room, but we also need to get to know each other so we speak the same language. And that's why, that glue bringing us all together, we all share the indoor air, and that's important. Multi-pollutant, so we hear about, we've got the biological hazards and we have the physical and chemical hazards within our indoor environment. But what happens when they all happen together? And so if you've got COVID and then you're exposed to high smoke, and we're getting compounding effects, and so I think some of the science there I'd like to see advanced in that space. Monitoring, we have the technology, we could do it now, and we want to do that. We obviously need databases that pull it together so we can see it and we can act upon that. Sensor design though, there are some pollutants that we can't measure easily now, and we need to drive those costs down for those sensors. And then the last bit is management. If you're monitoring something and then not looking at the data, you're not managing that threat. So, and we want to put in interventions, and we want to know that those interventions are safe. So working around ensuring that our air cleaning technologies have safety standards as well.
Thank you. So with those interventions, what sort of assurance should we be looking for before we put those interventions in place? I'd like to ask you that, and then maybe Suman, you might have some thoughts on that.
So in California, for example, some of the interventions have to pass a certain standards, etc. And so globally there are those standards, and we don't have that in place yet. What that is that you have standardised testing facilities, that all products go through that, and so the public is assured that the product they're buying is delivering what they hope it's going to be doing.
Thank you. Suman, do you have some thoughts on that?
Yeah, I think I can add to that, and I agree that just today also in Parliament there was, I mentioned before, a round table on the MRFF and research, and part of this whole piece and puzzle is what Australia and we can do in the innovation and research space. There's a tangent, I'll come to it, but I think it is related to your point around the testing and quality, where there is a huge opportunity to shape the market with indoor air quality products and technology. We've got colleagues in the room working in that space, and there is a gap between that product testing and regulation and that piece, and that's something a multidisciplinary intergovernmental task force could actually work together on, because it can't just sit with the TGA alone. This requires inputs from physicists and engineers into those parameters to inform that. I think that is one of the challenges, because there are products around that perhaps have different approaches to testing and verification, but experts do know how to do those assessments and how to make those recommendations. So going back to that point, the low-hanging fruit is actually coming out with this implementation and practical guidance. There's enough there to put those documents together, and we'd like to see governments, states and national, go forward to put together air quality guidelines.
Thank you. Do any other members of the panel have any thoughts they'd like to add? Lidia, maybe? Anything you'd like to add, Lidia?
Is it on?
Yes.
Yeah. All right. Well, in terms of this practical implementation, there will be an official announcement, like in about 2 weeks or so. We didn't want to do this all at the same time, about the practical implementation project at QUT. That the P block at QUT will become the first building in the world to meet the proposed indoor air quality standards. This will be due to philanthropic support and the support of the University QUT, and the idea is that sensors will be installed in every spaces. Sensors will be transmitting information to an AI platform which we are developing, which will in turn send a message to the building management system to control things. This will require a certain level of retrofitting, which is possible, which is not extremely expensive. And all this will be on open platforms. So we will demonstrate, well, the data coming from this and demonstrate that it's working well. Hope it will be working, but also exactly the rationale for the decision, why the sensors, how it was done, how much, what was the price of any retrofitting, such that it is very detailed information for others. And we already have kind of hands put up for other organizations and buildings who want to join this and do the same. So once we start this, it will be done. This was already published at 2 conferences, the sort of in general, but once the money was in the cryptocurrency pocket, which was quite a challenge, as this was the first time it happened in Queensland. And then we now know that we have the money, and as I said, an official announcement will be very soon. So that's our research. So it's not research in an experimental chamber in the lab. It's just to demonstrate that it can be done in the reality and how.
Fantastic. That's such an amazing message. Thank you. I do know that Liam has to head off pretty much at 2:30 sharp for a flight, so I'm going to ask you a question before you go, and also maybe Anna Maria can contribute to this one. Because you obviously come from 2 very different worlds. What would you say is the most feasible next step for progressing indoor air quality policy in Australia?
Well, I do think work health and safety provides a very fast pathway to doing this. As I said, the framework's already there. Employers, PCBUs, includes facilities managers, anyone operating a building, has a duty to ensure health and safety so far as is reasonably practical. We have regulations about how duty holders meet that in relation to a range of hazards. Ventilation, air quality is one area that we think some small tweaks to the regulation that actually set out, well, what are the values that indicate what healthy indoor air quality would look like, are a gap that can easily be plugged. We have the science, we have the framework, it's about picking it up and implementing it. To the issue about how then businesses go and comply, well, we think reasonably practicable provides a pretty good pathway for that. It is fundamentally a risk-based approach. It recognises the likelihood of harm and essentially increases the obligations where that occurs. So, for example, in an aged care facility, that bar is much higher. In another environment with less vulnerable people, potentially where there are other factors at play that might minimise the risks, then obviously the bar is lower. So it's a very adaptable, dynamic framework. Again, to the point that was raised by Anna Maria, we have a national system. So we don't have national laws, we have a harmonised approach. Safe Work Australia, custodian of our model laws, can implement this pretty quickly. We saw it done with rapid speed in relation to engineered stone. It took us 80 years to ban asbestos. It took us 4 years to ban engineered stone. So we can do things very quickly when there's the political will to do it.
Anna Maria.
I agree wholeheartedly. Our report recommends a range of different policy pathways and some in parallel. But if you had to prioritise one that met and enabled national action, that enabled every public space or workplace to benefit from better indoor air, it's the Workplace Health and Safety Framework. It exists, it's respected, it's understood, it's implemented across the country. It's a great starting point without letting any of the other policy lever owners off the hook, but it would be absolutely the place to start. Amanda Rishworth, we're coming.
Brilliant, thank you. I'm mindful of time, so I'm just going to ask everybody a question that Anna Maria sent me, which I just think is a beautiful question. Can you each share with us your vision for what Australia's indoor air quality policy landscape and what our buildings may look like in 2030? Starting with Robyn.
I think what we're asking for here at the moment is just compliance, and I want best practice competition. I want a race to the top.
Well, I hope that those who will be coming to this field then in 2030 would be saying, what are we talking about? This is so obvious.
Yes, brilliant. Thank you. Anna Maria?
In 30 years, we aren't speaking about it. We walk into a workplace, our health is better, our performance is better. It just happens. We take it for granted, like we drink water, like we eat food, and we're on to the next thing we need to solve.
Wonderful. Suman, the final word on this.
Yeah, I mean, I think the other big thing is awareness. We want everyone to actually know what we're doing and why, and then we want the people that are responsible, like building managers, to be implementing things in the background. So then it's not an issue for individuals, and that's the one big frame today that have to carry the burden and take different precautions.
Thank you so much. I can ask everybody to give appreciation for our wonderful contributors today. Thank you all for coming, for your attention this afternoon. I really hope you found this session valuable, insightful and inspiring. And above all else, I hope that you go away even more dedicated to helping with the change. Most of our panel members will be around during tea, but if you have questions or you have a question for Liam, feel free to email them to info@thesaferairproject. And thank you again for being part of the discussion. Enjoy your tea, and we'll reconvene back here at 3. Thank you.